Avoidance of risky substance, alcohol, and tobacco. When the pandemic started, alcohol sales skyrocketed. Drinking may ease stress in the moment, but in the long run may mess up the balance and cause more adverse effects. Alcohol consumed in large quantities exacerbates symptoms of anxiety, depression, and pre-existing mental health issues, increasing risks of acute injuries and chronic diseases, such as cancer and liver disease. This is alarming, and we should pay special attention as there could be significant post-pandemic impact on individual and on healthcare system in Canada. As a guideline, experts recommend for men not to consume more than 3 drinks a day and for women no more than 2 drinks a day on most days. It should be noted that consuming alcohol will not destroy the virus and will not give you any kind of protection against COVID-19. If anything, drinking alcohol is likely to pose more health risks if a person is infected with the virus. People who are chronic alcohol consumers cannot just eliminate alcohol easily. It takes time, involves being on medication and counseling. Slips and relapses are also normal and part of change. Set goals to start making changes and keep individuals on track. Tobacco use is the leading cause of preventable premature mortality globally and in Canada. In Ontario alone, 16,000 deaths a year are attributed to tobacco use and has a direct contribution to healthcare costs. Studies infer that smoking tobacco would predispose an individual to have severe outcomes for COVID-19. Therefore, if smoking tobacco is a risk factor for COVID-19, this may present a modifiable risk factor with opportunities to reduce risks in some individuals. The act of smoking, which involves frequent hand-mouth contact, or how smoking can be seen as a social activity among peers, presents an increased risk for SARS-CoV-2 to enter the body and act as a vehicle for transmission of virus. It is known that smoking is an established risk factor for respiratory infections that activates inflammation, impacts immune system, and has a strong relationship with pre-existing medical conditions. It is suggested that smoking or history of smoking is associated with disease progression among hospitalized patients with COVID-19. Smoking was also found to be associated with severe complications requiring the need for medical intervention, for example, admission to intensive care unit and use of mechanical ventilation. According to a recent survey done by Statistics Canada of substance abuse among Canadians during the COVID-19, specifically use of tobacco remains unchanged. This is alarming as there is a clear association between smoking and prognosis of COVID-19. What is known, however, is that effects of smoking can last for many years, but cessation of smoking causes an improvement in lung function and overall decreases the burden of chronic diseases. It was reported in the lung health study that there was a 15% reduction in all-cause mortality rates in individuals who decided to quit smoking. Regardless of the relationship between smoking and COVID-19, there is evidence that quitting smoking at any point has health benefits and reduced adverse effects for comorbidities associated with severe COVID-19. Addiction can be considered as a chronic disease wherein individuals have an increased dependence on substances such as alcohol, drugs, and tobacco, negatively impacting health and well-being. People who suffer addiction often feel neglected and are not given the same kind of treatment available to people who are suffering from other chronic diseases. There is no surprise that many health outcomes are attributed to lifestyle factors and that the use of alcohol and smoking are just some modifiable contributors that have significant effect on health. One of the goals of lifestyle medicine is to change public opinions and policies to empower people with their journey. Good way to do this is by following what we call SMART goals. Specific, what steps do you have to take to reduce substance abuse? Measurable, by how much will you reduce it? Attainable, will you be able to follow through? Realistic, what can you actually do to accomplish this? And time connected, how frequent are you going to do this? How long are you committed? Public opinion of people coping with addiction should be changed. As simple as offering help, kindness, and compassion goes a long way. This is in line with the practice of lifestyle medicine that people are more than their disease.